Hey everybody, this next topic that I want to cover on Genuine Questions is going to be about the pandemic and COVID, and there's a lot to say about it, so I'm going to break it up into a few different shorter parts here. And this first part is going to be about the misinformation around COVID and some of the reasons why people were skeptical of what the major news outlets and the experts were reporting to us. So we already covered some of the misinformation and hypocrisy in the Fauci episode of Genuine Questions, and I don't want to repeat too much of that, but fortunately or unfortunately, depending on how you want to look at that, there is a lot of examples that we can use that we haven't talked about yet. And one of the things that I have found frustrating about this debate or COVID conversations that you have with people is about the effectiveness of the masks. And you can track the source of a lot of this confusion back and forth about whether or not masks work to Dr. Fauci. But one of the things people will say a lot is, well, if doctors wear masks in the hospital, then of course they would work on people in the public. Like, they say it's like the most obvious thing in the world. Well, if masks don't work, then why do doctors use them? And you don't have to take my word for it. Again, Fauci is here to explain that to us.
Should we all be wearing masks?
No.
Why?
Because right now there isn't anything going around in the community, certainly not coronavirus, that is calling for the broad use of masks in the community.
Why do healthcare workers wear masks in the hospital then?
Well, because a healthcare worker who is taking care of someone who is known infected with a transmissible virus, that's different from walking around in the streets wearing a mask.
Now, I think that seems pretty obvious, but when I tried to say that to people, they said I wasn't a virologist or whatever, and I should just listen to the experts. So I'm just pointing out that I was listening to the experts. It was Dr. Fauci that didn't have a more scientific answer other than just pointing out the obvious. There's a difference when you're in a hospital operating or up close with an infected person versus just walking around at the grocery store. But however you want to look at that, Fauci was either lying then when he said that masks don't work and people don't need them and they're not effective in the public setting like that, or he was lying now when he says that everybody should be wearing 1 mask, 2 masks, 3 masks. Whichever way you want to look at that, you have to acknowledge that at some point in this timeline, Fauci was not being honest as the expert that we were all supposed to look to for information. But it wasn't just Fauci that was downplaying the virus or giving confusing mixed signals about it. Pretty much the entire media was initially downplaying the severity of COVID. And I'm going to show this clip of some of this news footage, and I left in the part where Trump actually introduces the video before it plays, just because I think the way he calls out the media here is pretty funny.
We have a few clips that we're just going to put up. We could turn the lights a little bit lower. I think you'll find them interesting. And then we'll answer some questions. I'll ask you some questions because you're so guilty, but forget it. Please, you can put it on. Thank you.
People should be more concerned right now with the flu in this country.
A lot of people are concerned about the coronavirus because they're hearing a lot of news about it right now. But the reality is, comparing it to the flu, for example, it's not even close to being at that stage.
What if it is worse? Is this a moment where maybe countries put politics aside, a little bit of pride aside, and do we have U.S. officials? Should U.S. professionals such as yourself get involved?
How worried should Americans be about coronavirus?
Coronavirus is not going to cause a major issue in the United States.
Business owners in San Francisco's Chinatown are struggling with a slump in business due to fear surrounding the coronavirus.
It's exciting to be here, especially at this time, to be able to be unified with our community. We want to be vigilant about what it might be on the what is out there in other places. We want to be careful about how we deal with it, but we do want to say to people, come to Chinatown. Here we are.
So even in that video, Nancy Pelosi cares more about the economy in her district and making sure that businesses aren't suffering in Chinatown than she cares about public health. But people only want to act like Donald Trump put the economy before public health, even though if you listen to Fauci at these press conferences, he says that every time he came in and gave a recommendation as the medical expert, which a lot of times differed from what the economic experts recommended that Trump did, Trump always took the medical experts' advice. But media doesn't want to report on that and wants to act like it was Trump supporters and Donald Trump who were downplaying the virus and not Nancy Pelosi telling everyone to go hang out in Chinatown and spread your germs around. So again, they are either lying to put their politics or the economy before public health, or they are lying about the severity of the virus. And there's no better example of that hypocrisy than when it comes to the various protests that happen. So when you have the people who are outside protesting the lockdown, those people are dangerous. They're going to spread the virus. But you have the nurses right across the street who are the counter protesters who are arguably more likely to have COVID because they have been around the infected patients when they're working in the hospital. Those people were not accused of spreading the virus, and they were held up as heroes for being outside protesting during this pandemic. But the people across the street with the opposite cause, they were the dirty plague rats who were spreading the virus. Or when you had the Black Lives Matter protest over the summer, we talked about this in a previous video, they come out with all these articles and scientific studies that say that these protests don't spread the virus. But when it's a protest against the government, then all of a sudden they do spread the virus and it's a good idea to shut them down. And in these next two videos, we're going to watch Fauci flip-flop on being hesitant to shut down a pro-Democratic Party Black Lives Matter protest during the summer, doesn't want to opine on whether or not that's a potential spreading of the virus and whether or not that should be shut down. But then in the next video, we'll see that when it comes to a protest at the Capitol against the government, he's all on board with shutting those types of protests down.
Dr. Fauci, do protests increase the spread of the virus?
I think I can make a general statement.
Well, 500,000 protesters on June 6th alone.
Yeah.
I'm just asking that number of people, does
Yeah.
it increase the spread of the virus?
Crowding together, particularly when you're not wearing a mask, contributes to the spread of the virus.
Should we limit the protesting?
I'm not sure what you mean. How do we say limit the protesting?
Should government limit the protesting?
I don't think that's relevant to.
Well, you make all kinds of recommendations. You made comments on dating, on baseball, on everything you can imagine. I'm just asking you just said that protests increase the spread. I'm just asking you, should we try to limit the protests?
No, I think I would leave that to people who have more of a position to do that.
No limit to protests, but boy, you can't go to church on Sunday.
I don't know how many times I can answer that. I'm not going to opine on limiting anything. I'm just going to tell you.
You've opined on a lot of things, Dr. Fauci.
Yeah, but I've never
This
said
is something
to
that
limit
directly impacts the spread of the virus, and I'm asking your position on the protest.
Yeah, I'm not going to opine on limiting anything. I'm telling you what it is, the danger. You could ask it as much as you want,
advocated for
and I'm
certain
not gonna
businesses.
answer it.
You've advocated for certain businesses to be shut down. I'm just asking you on your position on the protest.
Right now, we should be doing things that separate us as best as possible from people who might be infected. For example, crowds. We just heard that they're going to limit access to the Capitol. That's a really, really good idea to do.
So now that we've seen his different standards on whether a protest is good or not, depending on what the political cause is behind it, we're going to watch him pretend like he is not a partisan political hack and act like COVID doesn't know if you're a Democrat or Republican, so we all need to come together. And I just think it's interesting that it doesn't know if you're a Democrat or a Republican, but it definitely knows if you're outside doing an anti-lockdown protest or a Black Lives Matter protest. And it knows if you're 6 feet away or 5 feet away from somebody. Or it knows if you're walking the correct direction down the aisle at the grocery store. Or it knows if you're sitting down at a restaurant or standing up. So it does have a funny way of knowing a lot of things about the situation in which a person is, if it's going to spread or not. But here's Fauci letting us know that it's definitely not political.
I think what we need to appreciate is that we are dealing with a common enemy, and the common enemy is the virus. The virus doesn't know if you're a Republican, Democrat, or independent. The virus just knows that it makes people ill and it kills people.
Now, what really infuriates me about these people, and we'll get into this a little bit more later, but is how they are messing with kids to push their narrative, and they don't care that they've set an entire generation of kids back in school and all the other unintended consequences that have come with these COVID lockdowns. And this next video is the CDC director. She is asked about the science evolving, how we went from you need 6 feet of social distance to now all of a sudden you need 3 feet of social distance. And her answer is ridiculous. So I'm just going to play that for you right now.
It was 3 feet or 6 feet and then 3 feet, indoors and outdoors. So many things have evolved. And I think with something as uncertain as this, it's natural to have that dynamic. Where in time and does natural infection go along with vaccination to have some weight in that point in time where cases really start to fall off the chart?
In terms of the 6 versus 3 feet, I think from the school guidance, the first iteration that was put out in February, the biggest challenge to getting children back to school was the 6-foot guidance. What happened soon thereafter is science emerged. And because 6 feet proved to be such a challenge, within a month, we had 3 studies that demonstrated that 3 feet and 6 feet were equivalent for younger children. And so it was based on those science. I would really like to say that we're in a static situation here and that the science isn't changing, but we are changing our guidance as the science evolves and as the science emerges, and we have to remain humble to that science.
So I find that amazing, again, that the virus knows that if you're a younger school child, that you only need 3 feet of social distance. How the virus knows that, I am not sure. I also had one person tell me that when you're a kid, like age 4 and under, I think it might have been that if you take your mask off in school, it's okay because there's actually like this 15-minute grace period or window before the virus can start to transmit when it's younger kids. So the virus inside your body knows whether or not you're wearing a mask, and when you pull it down, apparently it just like counts down 15 minutes before you become contagious. That's amazing science that emerged right at the exact time that they needed it so kids could get back to school. Because as she said, they have this problem that you can't socially distance people 6 feet in the classroom. There's not enough space. And then within a month, the science just changed. And she didn't really say like how or what study was done or anything. Just the science changed. And now like we can do half of that. And as long as they're a school age child, it's totally fine. That is ridiculous if you think that that is how science works. And I'm tired of hearing people say, well, the science is evolving, because I could understand that if we were doing everything the way that we normally did it, and then new information was emerging and we had to develop new methods. But in the case with coronavirus, we did a whole bunch of things that we don't normally do, like lock down the country, quarantine healthy people, mandate vaccinations, shut businesses down, suspend the Bill of Rights. We did all of these things that we've never done before, and it was a disaster. And then once the data came out, it turns out that, like, it's what we always have done in the past. So the science didn't really evolve into anything. It just was what we already knew all along, and what people had been saying from the beginning, that people were called conspiracy theorists when they said that. But we'll talk more about those conspiracy theories in the next video on this topic. But for now, I want to talk about the misinformation that was surrounding the drug ivermectin. And this next clip is Dr. Robert Malone on the Jimmy Dore Show. And he was one of the inventors of this mRNA vaccine. And he is on Jimmy Dore Show talking about the conflicts of interest that have gone into this vaccine rollout, and the people who are benefiting from a lot of this misinformation that we're going to be talking about.
So the point is, you've all been subjected, I'm going to say it, to a heck of a lot of fear porn. That maybe serves the interests of the pharmaceutical industry. It serves the interests of the major media outlets that, by driving you with fear, they get readership and clicks and everything else. And many of these major outlets like Google and Facebook have significant investments in not just pharmaceuticals, but in vaccine companies. So you really got to be careful. We got a whole lot of conflict of interest going on here, and a lot of people controlling your thinking through the information they present to you. And you've seen it in action recently. If you were a skeptic, all of the, just bizarre inundation of press and information about ivermectin as a horse drug. In Africa, Merck has been donating millions and millions of doses for decades to Africans for river blindness and other conditions. And ivermectin is extremely safe when dosed at the right levels. All of this media chatter about don't use horse ivermectin is just it's noise. It's a distraction. I don't know, it appears that our media has been captured by our pharmaceutical industries. And those that spend time trying to ferret these things out see that there's a lot of evidence that this is the case.
Yes.
And now I'm going to show you guys some of that evidence that this is the case, because in order for them to have gotten their emergency use authorization for the COVID vaccines, one of the stipulations is that there can't be any other treatments available. So you couldn't have a drug like ivermectin that was successful at treating COVID, because if you had that, this widely approved wonder drug that is on the market that treats all kinds of viral infections, if you can show that that can be used as a therapeutic treatment for COVID, then you can't get your emergency use authorization. And I'd also like to point out that one of the biggest criticisms that you hear about ivermectin is that it's being used off-label. So it's an antiviral drug, has had a lot of success treating similar diseases, but since it hasn't specifically been tested for COVID, people criticize it and say it shouldn't be used off-label. But it's those same people who have no problem with using a drug like Lupron off-label as treatment for gender dysphoria, because what that is actually used for is to chemically castrate sex offenders. So they have no problem using Lupron off-label that chemically castrates someone versus using ivermectin off-label which is a drug that treats viral infections for a viral infection. And I don't understand how you can hold both of those opinions at the same time.
Ivermectin is on the WHO list of essential medicines. You would never know that if you were a casual consumer of news or even a serious consumer of news in the United States. You would never know that. You would think that this is some kind of horse medicine drug instead of what it actually is, and a medicine that's been prescribed to billions of people around the world and is on the WHO list of essential medicines. In fact, this is from the NIH. The NIH says it has had a measurable beneficial impact in improving the lives and welfare of billions of people throughout the world. That's from the NIH. They're talking about ivermectin, and it has immeasurably beneficial impact in improving the lives and welfare of billions of people throughout the world. Again, that's from the NIH. And this is right now, this is from the NIH. The NIH is saying that they're not saying that COVID doesn't work. They're not saying that ivermectin does or doesn't work. They're saying that there's insufficient evidence for either for or against the use of ivermectin for the treatment of COVID. So what they're recommending is that well-conducted clinical trials need to be taken care of so they can provide more specific evidence for the guidance. And why do they say this? The rationale for them saying we need studies is because it's been shown that ivermectin has been shown to inhibit the replication of SARS-CoV-2 in cell cultures. So now the NIH, CDC, is now recommending that doctors prescribe this in controlled trials. So that's right from the NIH. NIH says ivermectin shown to inhibit the replication of SARS-CoV-2 in cell cultures, and they recommend that doctors start giving it to people for studies. So it's the exact opposite of what you're hearing in the mainstream news media, and a lot of us suspect it's because of the undue influence of pharma. In fact, the people who invented ivermectin won the Nobel Prize for Science, and you would never know that, by the way. You would watching the news or listening to the news.
In fact, if you watch the news or listen to the news, you would be severely misinformed about ivermectin. They keep printing fake articles talking about how it's a horse dewormer, and I'm going to show this other clip from Jimmy Dore where he talks about this blatant lie that the Rolling Stones printed and then doesn't get fact checked on, and the media runs wild with it.
The Rolling Stone, this is a big story over the weekend. They printed a completely bogus false article about ivermectin and people in red states using it. It says gunshot victims left waiting as horse dewormer overdoses overwhelm Oklahoma hospitals, doctors say. That's from September 3rd. Now that's completely made up. There's not one piece of that that's true. Not one person was being treated at the hospital for ivermectin. Nobody, gunshot victims were waiting. Nobody. Everything was operating as normal. Completely false story that Rolling Stone printed, and it got passed around the internet like crazy. This is the message from the hospital. The hospital says, so they based this on an interview this guy, Dr. Jason McLeod, did. They said he's not an employee of the NHS Sequoia, which is the hospital. He is affiliated with the medical staffing group that provides coverage for our emergency room. With that said, Dr. McLeod has not worked at our Salisville location in over 2 months. NHS Sequoia has not treated any patients due to complications related to taking ivermectin. This includes not treating any patients for ivermectin overdose. All patients who have visited our emergency room have received medical attention as appropriate. Our hospital has not had to turn away any patients seeking emergency care. So what the Rolling Stone then did, by the way, a million other news organizations picked up this same morning, including Rachel Maddow, including the Newsweek, all of them picked this up and repeated it all they had to do was pick up the phone and call the hospital and ask them if it was true. And none of them did it. They didn't do the bare minimum of journalistic ethics or investigation. So what the Rolling Stone did was they didn't take the article down. They just printed this thing above it, and they left the whole article up, which is 100% misinformation. And by the way, they're not going to lose their Twitter page or their Facebook page. There's no note on this article on Twitter when you want to retweet it that says, "Are you sure you want to retweet this? This is maybe not. This is a conspiracy." So what Glenn Greenwald says is the only reason Rolling Stone is calling this an update as opposed to what it so plainly is, a retraction, is because liberal outlets know that their readers don't care at all if they publish fake news as long as it's done with the right political motives and goals. So what this story did was it was dunking on Oklahoma, red state, and it was dunking on dumb, what they consider to be Trump voters who take ivermectin, horse dewormer, to treat COVID. Oh, they're also crazy. Well, again, that didn't happen. It's a completely made-up story. Why do you got to make up stories to scare people? Of course, it's going back to the fear porn we're talking about. Also, this gives people a false sense of superiority that they're all vaccinated and not taking that.
So that's a really good question. Like, why would you make up fake stories just to push fear and an agenda if you're trying to get your credibility back? There was nothing about that Rolling Stone story that was true. So it's really hard to say that they just got it wrong. It seems a lot more intentional, as though they were lying about it. But it's not just the media who lies about it. It's the pharmaceutical companies and the government experts that we're supposed to trust. That's what I'm going to show you here in this next video, is the FDA commissioner talking about the rigorous safety standards that these vaccines have to go through before they get rolled out to the public.
Beyond diagnostics, we've evaluated emergency use requests for ventilators and novel devices such as continuous renal replacement therapy products. We continue to review additional submissions for COVID medical devices and rigorously monitor safety signals and reports, including their performance against variants for the products on the market. This is in addition to addressing numerous device shortages that occurred during the pandemic and working with our government partners to prevent counterfeit and substandard PPE and other products from entering the United States. Because of course, people take opportunities to try to get substandard products into the country. In addition, FDA has issued EUAs, as you know, for 3 COVID-19 vaccines. These vaccines were authorized without cutting corners or sacrificing our rigorous standards. Intensive interactions between FDA and manufacturers minimize the time between different ordinary phases of the clinical development process and allowed for seamless movement through development, manufacturing, and our rigorous scientific review. Throughout the vaccine authorization process, we took steps to facilitate transparency and trust by posting trial data, putting out guidances on what our standards would be, key decisional memoranda, and we held public advisory committee meetings. These vaccines have met the standards and quality to support an EUA and are helping, as you've heard, in our fight against the pandemic.
So just a couple of comments about some of the things that she said there. She touts the level of transparency, but as we're going to see here in a couple of minutes in a little video clip, there was no transparency at all. That's a blatant lie. Then she also talks about how there might be bad actors out there putting substandard PPE or therapeutics onto the market to take advantage of people during a pandemic. And I do agree with her that could happen. I just also think that there could be bad actors out there pushing a vaccine, and that we should have those same rigorous safety standards for an mRNA vaccine that we do for our PPE. Because the last thing that I noticed that she said there is that they did a lot of like intensive talks or like rigorous communication or something, which is what facilitated the rapidness of the vaccine rollout. But I don't care how often you talk to each other and how great your communication is, that cannot substitute for long-term data. That's why most vaccines are like 10 to 15 years in clinical trials before they go out into the market. So you have some long-term data. There's no way that talking and having conversations in any way, shape, or form speeds up the timeline in order to have long-term data. And it's ridiculous that some people obviously think that that's an acceptable answer. And in the absence of this long-term data, we are left with just what people are reporting in the short term. And you hear a lot of criticism about this vaccine adverse event reporting system, the VAERS website. And when you try to show people the data on there of all of these negative side effects that have happened, they'll tell you that that's not a good data source because anybody can go on there and type in whatever they want, and there's no way to even check that it's true. So I found that interesting because I was listening to one of these Senate hearings, and I'm going to show you this clip where it starts with Mitt Romney suggesting that maybe we're all victims of Putin propaganda if we don't want to get vaccinated, and I just think that's funny. But then the director of the CDC, she touts this VAERS reporting system as a really good tool that helps keep the public informed of what these side effects are. And her chief complaint with it is that things get underreported because it is left up to people to go in there and report themselves. She doesn't say that the issue is people making false reports on it. She said that there's actually probably not enough information. So people want to call you a conspiracy theorist if you're checking that website for data, but that's the website that the director of the CDC suggests that we all go to keep ourselves informed.
As we try and understand vaccine hesitancy, I'm sure some of that is due to spurious conspiracy theories. And perhaps, I don't know this, but social media may be populated in part by enemies of our country that are putting out theories to try and get people not to take vaccines. But there's also, I believe, another reason why some people who are not prone to believe those conspiracies don't get vaccinated, and that's because they don't know what the data really suggests. That information being collected, are doctors and hospitals actually collecting the data that shows how many people are getting side effects by age group? Are you getting accurate information that people can rely upon?
We have the vaccine adverse event reporting system. That's a passive reporting system. Everything gets reported or is supposed to get reported, but we recognize it's passive. Things may get missed.
So their entire basis for this vaccine mandate was the idea that it prevented transmission and that you were protecting everybody's grandma and you were a good person protecting vulnerable people by doing this. But now the data has come out that, and the science shows that the vaccine does not prevent transmission, it does not prevent infection. What it does is it lessens the symptoms for the individual and lessens your chance of hospitalization. So even Bill Gates now says, when asked about vaccine mandates, he says, what's the point? If the vaccine doesn't stop transmission, what's the point of checking people's vaccination status? But it's hard to argue that from their perspective that this is what the data said and they assume something different at the beginning, because now the information has come out from Pfizer that they never even tested to see if it stopped transmission in the first place. So that entire basis of it stops transmission and you're protecting everybody else and you're a good person for doing this, that was based on no data. Pfizer admits they didn't have it, so there's no way for the government to have that before they instituted those mandates. And now they are trying to act like that's not a scandal and that they never said that it stopped transmission and that they've admitted this from the very beginning. But again, if that's true, there's no basis for their vaccine mandates. And we're going to watch this video clip here, first of all of our experts and officials who we're supposed to trust lying about this, and then it will go into the clip from the Pfizer executive admitting to the European Parliament that they never even tested for it.
Here's what Joe Biden and all the assholes were telling you for a year.
We're not in a position where we think that any virus, including the Delta virus, which is much more transmissible and more deadly in terms of unvaccinated people, the various shots that people are getting now cover that. You're okay. You're not going to get COVID if you have these vaccinations.
Now here's the head of the CDC, Dr. Rochelle Walensky. She's going to say the same thing.
Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real world data.
So now we had the president of the United States, we had the head of the CDC. Now let's get the #1 news show host on television to tell you that same lie. Let's watch.
We know that the vaccines work well enough that the virus stops with every vaccinated person. A vaccinated person gets exposed to the virus. The virus does not infect them. The virus cannot then use that person to go anywhere else.
So now we had the #1 news show on television. That was Rachel Maddow during Russiagate. She was the #1 news show. She lied to you at the top of her lungs. We had the head of the CDC lying to you. We had the president of the United States lying to you. Who did that leave out? That leaves out Fauci. Let's listen to Fauci. Let's see if he tells the same lie.
Vaccines prevent getting infected, prevent getting sick, prevent your hospitalization.
That's what normal vaccines do. That's what vaccines have always done. Before they changed the definition, that's what vaccines did. So you heard them. So you heard them all say. So now the big thing that's going around is that they never said that. So that's why I'm showing you that first. Because here's a member of the European Parliament, and he was interviewing, or he was questioning in the European Parliament. He was questioning Janine Small. She's Pfizer's president of international development markets. She was testifying before the European Union Parliament on Monday. This is last Monday, when she was asked this question by, he's a Dutch member of Parliament, and let's watch what he has to say about his questioning of the Pfizer executive. Here's what he says, and then I'll show you the question.
If you don't get vaccinated, you're antisocial. This is what the Dutch Prime Minister and Health Minister told us. You don't get vaccinated just for yourself, but also for others. You do it for all of society. That's what I said. Today, this turned out to be complete nonsense. In a COVID hearing in the European Parliament, one of the Pfizer directors just admitted to me, at the time of introduction, the vaccine had never been tested on stopping the transmission of the virus. This removed the entire legal basis for the COVID passport. The COVID passport that led to massive institutional discrimination. People lost access to essential parts of society. I find this to be shocking, even criminal.
Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunization before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market. And from that point of view, we had to do everything at risk.
No, what are you, an asshole?
What?
You think we did that? Even though we assured everybody that we did all the things you normally do? And we
I
didn't
refute
do it?
that.
She acts like you're the idiot for asking her this question. And who does that? The people who do that, she's a criminal liar. So she knows what he's asking. She knows it's a scandal. She knows this is a scandal. And she's trying to laugh it off. Because what else are they going to do? They're fucking criminals. You don't think they're criminals at Pfizer, at Moderna, at Johnson & Johnson? The people who got half the country hooked on fucking heroin and the other half they put asbestos in your baby powder?
This is scandalous. Millions of people worldwide felt forced to get vaccinated because of the myth that you do it for others. Now this turned out to be a cheap lie. This should be exposed.
It was not even tested. Not that they tested it and the numbers weren't as good as they liked and they suppressed them. They didn't even test that part. But there are already people on Twitter, like, you'll say, hey, they lied about this stuff, and they'll go, hey, but nobody really knew what was happening. No, that's not. No, they were lying. They didn't make mistakes.
So up until like 2 years ago, nobody really disagreed that Big Pharma was corrupt. He said they're responsible for the opioid crisis. There's all kinds of drugs that have had adverse side effects. There's all kinds of corruption that goes on in Big Pharma. We could save that for another episode. But I just want to show you this clip here of Pfizer, and they had to pay out the largest fine in history for false advertising about what their products do.
American pharmaceutical giant Pfizer Inc. and its subsidiary Pharma. So watch this. That's important. This is going to come into play. Their subsidiary Pharmacia Upjohn Company Inc., hereafter known as Pfizer, they have agreed to pay $2.3 billion, the largest healthcare fraud settlement in the world, to resolve criminal and civil liability arising from the illegal promotion of certain pharmaceutical products, the Justice Department announced today. Pharmacia, an Upjohn company, has agreed to plead guilty to a felony. So these are the people right now. I just want you to know that's who these people are. This isn't a one-off that this happened. This isn't a one-off. Like, remember that one time? This is how the standard practice. It's better to pay a fine than not make billions of dollars trying to break the law. The Department of Justice made official today its $2.3 billion settlement with Pfizer over its illegal marketing of Bextra. In addition to the fine, 6 whistleblowers will receive more than $102 million in the recovery. So apparently they're doing some nefarious shit to the whistleblowers. Whose brand name will be tarnished by the company pleading guilty to a crime? Whose brand name is going to be tarnished? Is it Pfizer's? No, not Pfizer's. It is Pharmacia and Upjohn Company, which will cop to the felony violation. At one point, about 100 reps were focused on selling Bextra off-label. Their boss was Mary Holloway, who paid a $75,000 fine and is currently on 2 years probation. So again, no jail time. You pay a fine, and I guess I'm gonna guess she made $1 million a year. All right.
And so now I want to come back to what we talked about earlier with those FDA standards and transparency, because this is a video clip of a European parliamentary session where they are questioning the executives from Pfizer, Moderna, I can't remember which one, but they asked for the contracts between the government and the pharmaceutical companies, and they turned them over with all the pages just redacted. So they're just big black boxes and you can't read anything. So this is a product that is being forced upon the population with at least a portion, a segment of it against their will, but they feel coerced into keeping their job or being able to go visit loved ones or whatever social pressure was put on them. So don't people have the right to know this data and this information? But apparently the pharmaceutical companies don't think that we do.
Now, this gentleman here is Mr. Christian Terraz. He's an elected member of the European Parliament. And as you'll see, he's holding quite a few blanked out sheets of paper. So when members of the European Parliament asked Pfizer for copies of the contract that apparently Pfizer entered into with the European Parliament, the European Union, this is the level of transparency that they got back. And clearly Mr. Terraz is not impressed with this.
What was Pfizer got to hide? This is a question that we are all asking. What exactly in these contracts? What are they hiding exactly? I mean, in the previous press conferences, I showed you some of the pages, from these contracts. This is how they were disclosed to us and to the public and to the press. Obviously, after some of us and some of the brave journalists asked, what are the contracts signed between the European Commission and these pharmaceutical companies? So this is how they disclose the contracts. Over 100 pages. Every contract with Pfizer, with Moderna, tens of pages of those contracts were blacked out. So yesterday when we asked, I was the one asking, and some of my colleagues asked, when are they going to fully release these contracts? The representative of Pfizer who was sent to replace the CEO of Pfizer, said that they can't fully disclose these contracts because they have some commercial secrets over there, and they have to protect their interests. Now I'm asking you, what about the interests of our people? What about the interests of the Europeans whose money was spent, or wasted, I would say now, to buy these medical products that are not providing what they were marketed for?
And I want to show you this one other question from the European parliamentary session, because he has an interesting question about the data that they did provide and that they tested for this vaccine in 2017, 2018, 2019, but COVID wasn't even a thing until 2019 is what we were told. So how can you test for the vaccine if the virus didn't even exist yet?
Answer from EMA, which is showing for every vaccine the kind of tests that were done. So in the case of Moderna, for example, you provided data showing that you tested these vaccines since 2017, 2018, 2019. So how are you able to test these vaccines back then when we found out about this virus in December of 2019?
And no one's asked that question before?
First I'm hearing of it.
Isn't that so he's talking about the contract that a big pharma company has with a government, which gives them protection from anything bad that happens, right? So you can't sue the big pharma. They have all these protections. So I guess he's talking about the data that they've submitted to their country to allow them to distribute their vaccines. He's saying that you said you tested it in 17, 2018, 2019, but we didn't know about the COVID-19 until 2019. How could you possibly have done that? They don't answer. But
And then the last video that I want to show you here for this first segment of the coronavirus genuine question series is about the data that the pharmaceutical companies submitted for their booster testing, and that it was tested on 8 mice before they gave it emergency use authorization to the public. Again, this isn't stopping the transmission, it's not stopping the spread, but emergency use authorization based on clinical data from 8 mice.
FDA expected to authorize new COVID boosters without data from tests on people. That's right. It's only been tested on mice. Now put it in your baby. They're getting emergency use authorization. Emergency use authorization.
Like the original one.
Are the ICUs overrun again? Are there not enough doctors to treat people? Do we know not enough? Is it really an emergency? For the B4, BA5 boosters, the companies have submitted animal data. Not only that, they won't even release that data.
Wow.
They have not released those data publicly, although at the June FDA meeting, Pfizer presented preliminary findings in 8 mice. Oh, this is emergency use authorization. This is not, okay? So if we waited, so who's saying this? William Schaffner. He's the professor of medicine at Vanderbilt University Medical Center, and he told the Wall Street Journal that if we waited for clinical trial results, thank you very much, we'd get them in the spring. You're welcome. It takes time to do clinical trials. Top of the morning. This is just an updating of previous vaccine that we used. I said, good day.
But good day, sir.
Good day, sir. So this guy's saying, no big whoop. We tested 8 mice. Thank you very much. But then another doctor says this, and this is a guy who actually was on the FDA board. He said, I'm uncomfortable that we would move forward, that we would give millions or tens of millions of doses to people based on mouse data. Who said that? He's Paul Offit. He's the FDA advisor. He's an FDA advisor, and he's the director of the Vaccine Education Center at the Children's Hospital of Philadelphia.
You better get comfortable.
You better get comfortable with that. Exactly right.
So that's all that I have for this first video about the misinformation surrounding the COVID vaccine testing and safety data. In the next one, I want to talk about some of the propaganda and the commercials and the social pressure and coercion that they used in their vaccine rollout. So thanks for watching, and hope you tune back in for the next one.